going to see the subdural hematoma. Subdural hematoma is the rupture of the breathing veins. These breathing veins are the bridge between the dura and arachnoid meninges. So there will be rupture of these ones, and the patient will present with a subacute, acute, or chronic. We will focus on the acute, subacute, or chronic. So here the patient presents after a traumatic brain injury. It could be disorientated, and depending on the large extent is the treatment. On a CT scan, here in the acute or subacute we will see a hyperdensity that crosses suture. So here we have, let's say, a transverse section of the brain. We will see something like this. And the treatment could be surgical or non-surgical. If it is surgical, we mean the craniotomy. We will do this if we have lateralization of symptoms, because this means that there is a shift. Either the patient has the neurological deficit on this side, and we could see midline shifts, so something like this is going towards this side, for example, see something like this. There will be a profound midline shift, so in that case we should also do the craniotomy with evacuation. If we are not going to do the craniotomy, we would manage it by sedating the patient and decreasing the metabolic activity of the neurons. Hyperventilation. Here we try to maintain the partial pressure, arterial pressure of carbon dioxide between 32 and 35 millimeters of mercury, because remember that if we have carbon dioxide, there is vasodilation of these carotid arteries, so blood will go to the brain, and we don't want that because this would promote edema in the brain. So we want to decrease the carbon dioxide, but certainly we're not going to decrease it a lot, so there will be profound constriction. No, it's just that there don't be vasodilation or too much vasodilation. Now the chronic one, this is seen by tearing of the venous sinuses, and this is seen on the extreme of age, like in the children is most commonly seen with children abuse or shaken baby syndrome. It is seen on chronic alcohol, so the patient with alcohol constantly is falling to the floor or some traumatic brain injury, or is seen on elderly patients. Whatever thing they do, for example in the car or whatever, in the elderly patients there is atrophy of the brain, so the spaces between the, let's say, the dura and the arachnoid is greater, and so there is easily rupture of these veins, so the patient goes into trauma, and the patient does something like this, and so there is this movement of the vessel, this tearing of the vessels. So in the elderly, we should be very, very careful that they don't have any trauma to the brain, not falls, anything. And here the issue is that with chronic subdural hematomas, the hematoma is reabsorbed because they are small, so this is reabsorbed. So in the CT scan, we will see a hypodensity, again crossing sutures, but would be a hypodensity, and sometimes we can see acute subdural hematoma superimposed on a chronic subdural hematoma. Sometimes we can give steroids, but in the chronic subdural hematoma, the patient has decline on the cognitive function gradually because it is chronic, but we need to decompress the patient. So for the chronic, the treatment is emergent craniotomy.